Hi there, and welcome back to Sparks, a spotlight series from the Boost community. Today we are honored to welcome Musa Joshua Aboi, a field monitor at the subnational level, working at an international global health nonprofit organization to supervise 52 health facilities across Kaduna State, Nigeria. Today, Musa is here with us to talk about his experience addressing vaccine acceptance among fellow healthcare workers, including answering difficult questions such as, how do you promote vaccine acceptance among individuals who are trained in administering vaccines? Keep listening to learn about how Musa applied the skills he learned from Boost's Storytelling for Change course to reach vaccine-hesitant healthcare workers in his community.
My name is Musa Joshua Aboi from Kaduna State, Nigeria. I have been in the immunization profession for 6 years here in Nigeria. I am an immunization field monitor working for EPI unit at the subnational level. I am playing a role of supervisor during routine immunization and supplementary immunization. It was during this first phase of COVID-19 introduction, which was mainly for health workers. I went to this fixed post and I realized that the health workers were not vaccinated. I got to realize that through their conversation, I was just sitting beside, listening to their conversation, and I overheard them talking about the effects and the efficacy of the vaccine through the conspiracy theory that was going around in my own country. So I had to go closer and listen to them, even though they didn't even know that I was listening. I involved myself in a conversation with one of them, and they eventually confessed to me that they were not immunized due to different kind of reasons. One is that the vaccine will have negative effect on the people. Another one is they were saying, how can they create that vaccine in a very short time when they couldn't get vaccine for other timely diseases that have been around for years? And then there was this news of blood clots that came out due to AstraZeneca. Everybody was afraid. That's one of the side effects of the vaccine. So they were hesitant. The irony was that they were actually immunizing other people, but not themselves. In Kaduna State, Nigeria, the government came out with a policy that if you're not vaccinated, you will not be paid your salary. So it simply means that all of the staff must look for a way to have evidence that they have received the vaccine. The only way that they could prove that they have received the vaccine is to get the proof of immunization, which is the immunization card, and have the QR sticker on it, and it must be scanned to be proven that they have received the vaccine. These are people that are very familiar with the process of fighting hesitancy because they have been involved in the immunization activities. And because they are familiar with that, I was confused. What really can I do to have these people immunized, or what can I tell them to convince them actually that the immunization is necessary for them? So the only thing that came to my mind at the point was the storytelling. The storytelling has three components. You start with the story of self, which you talk about your own challenge that you had in life, the choice that you made when you had that challenge, and the outcome. The outcome actually could be the reason why you are where you are. So you must have your own story. As a health worker fighting vaccine hesitancy as your own work, what really brought you to where you are? What really brought you to that position that you are talking to them about? So now the story of us is all about the people. You have to talk to them about the challenges, the values in that society, the experiences that they once had together. In my own case, had to remind them about their experiencing polio in Nigeria. And I had to remind them about early stage of COVID-19, where we lost our colleagues, we lost doctors, and we lost other health practitioners in the field. They were their friends, they were their family members, they were their colleagues. You have to remind them of what those people passed through and how it ended for them. That is the experience we share together. The story of us is about doing something collectively, passing through an experience collectively, and having the hope to pass through this particular experience together. It's you evoking something positive inside them for them to stand for themselves and do something for themselves and for their own community, which is to stand against vaccine hesitancy, to get immunized, and to tell other people to be immunized because of the danger of the virus. So just like the early stage of coronavirus that came and took away people that we love, we have to stand together, just like the polio virus that came, the measles, the outbreaks that we once had that took away our children, that took away our relatives. Then the story of now, you have to emphasize the urgency for us to take action against this particular thing. Now that people are rejecting to take this vaccine, now we need to come together and do something about it, because if we don't, there are consequences. If we refuse to allow ourselves to be immunized, what will happen? You don't tell them stories to threaten them. No, you tell them story to make them realize what they are supposed to do, the duty that they have to themselves and to the community. So the storytelling is you knowing your people. It's not all about telling them a story. No, it's all about you telling them a strategy. What are we going to do? How are we going to do it? You have to tell them what you stand for as a community. You have to express those feelings. They have to feel it. That feeling of solidarity should be part of it. Then you have to have a clear ask. You have to ask them for commitment. And it has to be something that you want to do now. That's the urgency. Who is ready to start doing this thing? Now, we have to do it now. They have to show that sign of commitment by either standing up, raising their hand, or agreeing with you that, okay, we are going to do this.
I think my situation was successful because I had health workers gathered in one place. I tried applying it in the field, and it wasn't really working because people will not be patient enough to listen to you, patient enough to understand the message that you're trying to pass across. When you have a conducive environment for you to apply storytelling in a meeting or in an atmosphere where you have people that can really concentrate and listen to you, I think storytelling is one of the best methods for combating vaccine hesitancy. Right from the beginning, I never knew that it was going to be this life-changing. Storytelling has changed the way I work, especially when it comes to combating hesitancy. You have to give them examples that they are very familiar with, stories that have connected them to their communities. And by connecting those people with their communities and came out victoriously, let them feel the hope. Tell them a story that will bring out that sense of solidarity in them, that they will feel that actually we have to stand for our own community.